Good evening, everyone across the world. You are welcome to today's BHS Health Education Consult with our nurses. That is the BHS company, nurses and doctors. Today we have a presentation that we are going to share on some of the health challenges that people face across the world. And today we have one of our nurses, that is Dr. Kujodi, who is going to do the presentation to all of us. And so, kindly take note of this. My name is Robert Metonono. I'm the director for Brigham Healthcare Services. And we'll have other participants who will join us as time goes by. But Dorcas will now take over and continue this presentation. Thank you very much.
Okay. So,
Dorcas, you are now the
my
host.
name is
Go ahead.
Okay. So my name is Dr. Georgie, as mentioned earlier on. And today I'm presenting on how to manage menopausal symptoms. So one may ask, what is menopause? Menopause is the time that marks the end of your menstrual cycles. It is diagnosed after you've gone 12 months without a menstrual period. Menopause can happen in your 40s. As you approach menopause, your reproductive hormones drops automatically, which can cause a rate. Almost all women experience menopause at a symptoms of menopause at certain stage. Most women find men. When symptoms are particularly severe or prolonged, there are a range of ways to manage them. There are different ways to manage menopausal symptoms depending on their severity. Menopause is different for everyone. Some women have no symptoms at all, while others have symptoms that interfere with menopause, or what we may experience during menopausal states. One, we may have hot flashes. We may have night sweat. There is aches and pains on the body. There is swings, as we all used to say. One may experience migraine. One may experience difficulty in slow metabolism. You may also experience, or one may also experience, but there may be reduced sex drive, which is called libido, and there may be painful sex. So all these signs are, all this that I have mentioned are the signs and symptoms that one may experience when one is having post-menopause or is in the symptom. There are many ways to manage menopausal symptoms. It may take time. Menopausal symptoms are caused by a drop in hormones. You may be on menopausal hormone therapy. And this therapy is an effective and safe way to reduce symptoms, and they also reduce the risk of developing heart disease. So if one is thinking about taking this menopausal hormone therapy, one needs to talk to their doctor or see their doctor before being on that hormonal therapy. Note that those hormonal therapy is not suitable for the age of 60 or have hormone-dependent cancer. The person cannot be on the menopausal hormone therapy. And also, there are some non-hormonal medications that one may take to manage these symptoms of menopause. Some women may not use this hormonal therapy. Others don't want to use it. They may be on certain antidepressant medications, which can help them, especially those who are having sleepless nights. But now I want us to jump to how we can manage these menopausal symptoms. There are some healthy lifestyles that when we live, we can manage these menopausal symptoms. Those that I made mention are the medicational aspects that a doctor may prescribe that we can do or engage ourselves to reduce these symptoms of menopause. So it's important to look after yourself at this stage of your life when you have this menopause, as hormones are being reduced during this stage. So healthy lifestyle choices can help you manage symptoms of menopause. And it reduces the risk of developing healthy conditions. You can look after your physical health. For example, you have to eat a healthy diet, achieve and maintain a healthy weight. You can do regular physical activity, develop some good sleeping habits. You have to reduce or stop taking or drinking alcohol. Those are the healthy lifestyles that pinpointed. So you have to reduce or stop taking alcohol. You have to quit smoking and other drugs. It's also important to look at some of the things that we have to do to look after our emotional health. One, you can take time to do things that you enjoy. You can be kind to everybody, not that you can be kind. You have to be kind with everybody around you. You have to take your time to be close relatives or friends. And then also you have to communicate to families about how you feel. You have to practice some relaxation techniques and then work with a therapist. So with these healthy lifestyles, it can help each one who is going through these menopausal symptoms to at least manage those symptoms without even being on the hormonal therapy or taking any antidepressant medication or taking any herbal medication. I said earlier on, everyone with menopausal symptoms or may go through this menopausal state. So these are some of the healthy lifestyles that each and every woman have to live so that when we are in this state of when you are in this stage of the menopause. So when I talk to her doctor, when the symptoms are affecting her quality of life, when you get to know that these symptoms that you are going through after living these healthy lifestyles, yet the symptoms are what are affecting your quality of life. It is important to seek an accurate and reliable information before you start any treatment or medical treatment. So with a healthy lifestyle that I mentioned, exposure states can adapt to this lifestyles to manage their symptoms. Thank you.
Okay. So thank you so much, doctors. Thank you so much for sharing this wonderful piece concerning the health of women as well as sharing this wonderful knowledge. As we proceed, we'll now be calling one after the other to give contributions, and then if you have any thoughts or questions you want to throw, kindly do that. We'll start with Vida, and then we'll get to the rest, Ajua, and then the rest will follow. So what are your additions to what you have shared so far? Douglas, can you kindly put the main heading in the chat so that they'll be able to gather their thoughts to assist. Honestly, do you have something?
Okay.
Mr. Vida, what are your suggestions and your additions to what he has said so far? So, Douglas, can you give us a summary of your presentation briefly?
Okay. So, like I said earlier on, almost every woman, or to sum up everything, have your final period or menstruation. And then it is something that almost all women experience. Most women find these symptoms manageable and choose not to treat. Some also can treat it. So, in summary, when one is in their menopause, one needs to live a healthy lifestyle apart from the methods that doctors need to tackle to reduce the symptoms of menopause. The healthy lifestyle that one needs to live is to have eat a healthy diet. Okay, so when one is in their menopausal state, there is a must to eat a healthy diet. So that in order for one to maintain a healthy weight, and also one needs to do regular physical activities, and then also one needs to quit smoking, one needs to have a free mind. There must be a good relaxation technique. So, like I said earlier on, menopause is something that almost every woman they are at some certain stage or go through. So we need to live a level before and even after we are experiencing these signs of menopause.
All right. So that's okay. So we want to hear your additions on the topic. So we'll start from Vida, then we'll go to Watuma, and then we'll go to Abraham, Honesty, and then Ajua. Please want to hear from your thoughts on the topic. So kindly respond. Thank you very much.
Hello, good evening.
Yeah, good evening.
There's Vida. What I want to say about menopause is that it's a state of mental distortion during this period of time when someone is in her menopausal stage. It really needs a mental care, because usually during this time, our women in the village at this time even think the person is a witch, the person's behavior, the symptoms that the person is showing, gives them the impression that the person is a witch, which is not so. It's only because their mental state has been distorted and they behave really, as we all see. So during this time, I think we should get much closer to them, be much more in contact with them, having discussions with them to help them clear their mental state or help them have a stable mental state during this time. Thank you.
All right. Thank you very much. So, Ajua, what are your thoughts on what we are talking about menopause. And then after, we'll hear from Wahima, and then we'll go to honesty in that order. And Abraham, please go ahead. We are waiting. Kindly add your comments on the topic. Adua, kindly add your comments. What are your thoughts on menopause? And then we'll also go to Wahima and then Abraham and honesty. Kindly add your comments and your contribution. Thank you very much. Hello, honesty. Abraham.
Yeah, hello.
Please add your comments.
Yeah, hello.
Go ahead.
Yeah, so menopause marks the end of a woman's reproductive years, and this occurs in her late 40s to early 50s or early 50s. And this is actually characterized by decline in estrogen and progesterone production. And this can lead to some symptoms can come up like hot flashes, mood swings, and changes in the menstrual pattern. And menopause can uh, be managed by lifestyle changes, which comes in eating healthy diet and to some extent hormone replacement therapy. Yeah, thank you.
Okay, thank you very much, honesty. So let's also hear from Wahima and then Adua. We want to hear from you. So kindly unmute yourself and then share your thoughts on the topic. Thank you very much. Abraham, kindly share your thoughts on the topic that we are discussing.
Hello, please, can you hear me?
Go ahead.
Okay, all what I can add to what the presenter said or the facilitator said was that menopause affects women above 45, that's in the earlier term, above 50 for majority of them. And due to that, they are liable to getting all other conditions like osteoporosis, where their bones become brittle and they can easily break their bones and fall. And with that, we tell them to take in calcium supplements. And also because it marks the end of their reproductive years, we tell them to give them things to start coping with them and tell their family members not to brand them with a certain derogatory remarks and other things so that they could go through it successfully. And even though it also comes with its other illnesses and things, you could manage it also successfully. That's my take on it.
Okay, thank you very much. Thank you very much, Abraham. Thank you very much. So we will hear from Dorcas once again. Share with us, how to treat such a condition, and then we'll prepare to run up. Thank you very much.
Okay, so the first one I would like to talk about is the please a minute. So the first one I would like to talk about is the hot flashes, which are the symptoms. The one the number one, this thing I made mention. So the hot flashes, and then there are hot flashes and then vaginal dryness. And these are the two main symptoms most frequently linked with the menopause. Other symptoms associated with this menopause include sleep disturbances, urinary complaint, and those ones I made mention. So with the hot flashes, also called the vasomotor symptoms, hot flashes may begin in perimenopause stage. That's the early stage of menopause, or they may not start until after the last menstrual period has occurred. On average, the last 3 or 5 years are usually worse during the year following the last menstrual period. So for some women, they go on the amenorrhea. Definitely there may be absence of menstruation. So with the hot flashes, probably begin in the, which mostly begins in the hypothalamus. So I made mention that with these signs and symptoms, there are medications that they can use to treat, which is the hormonal therapy. So with those hormonal therapy, it is mostly prescribed by doctors. So even it's not every woman that can go through this therapy. So this therapy is being done to increase the level of the hormone. For example, I made mention that the vasomotor brings about the hot flashes, which brings about sleep disturbances. So when the person undergoes this therapy, it increases the level of hormones that have diminished or have decreased in the body system, so that at least it can reduce the rate at which the person is suffering. And also, there are other medications. There are also medications that one can take, which are the antidepressant medications. Some are the antidepressant medications, and also other medications that doctors will prescribe, which is sometimes used in treating epilepsy. I forgot of those medications, but yet still, most people, when they see the doctors, they can prescribe all these medications for them, that it can help them reduce these symptoms that I made mention of. Oh, thank you.
All right, all right. Thank you so much for helping us understand this. And we know that all our viewers who will be watching our discussions with our nurses and our doctors on different variety of health conditions will take some wonderful tips from this. And it will help them understand what menopause is, how to go about it, and how to treat and handle all of this. The most important thing that we must all know is whenever we have such conditions, we should try to be with friends, family, and others who understand the condition that they can also do with help. So basically, we'll end now. And thank you so much for joining us in this short presentation and discussion. And your contributions have all been heard, recorded, and we hope that others will also learn from it. Before we run up, I want to give just 1 minute to anyone who want to add anything concerning this very topic we have just discussed. So if anyone has any last addition, kindly do that. Thank you very much.
Okay, so I'll add some myself. Our sister Vida made mention that when women are going through this menopausal states, people used to call them witches and blah, 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 blah. But then I want to tell people or those watching us that women are those who are in their 60s, 70s, 50s going, when they begin to showcase some attitude or behaviors. It doesn't mean that they are witches, as our sister made mention. It is part of the signs or symptoms that women go through when they get to that particular state. Okay, so there are mood swings and there are depressions. Earlier on, before then, women mostly get depression more than men. So when they are of that age, the depression becomes more. So some of the behavior changes could be that the person may be even laughing more, the person may be irritated with a little thing that you do. There will be some behavior changes that one may not understand. And all these things doesn't mean that the person is a witch. or is demonstrating some spirituality or something, we should all know that it is a sign or symptoms of menopause. So we should treat our elderly women or our grandmas and the women around us with love and care. And we should at least show them some love. Okay, so that's it. Thank you.
All right. Thank you so much, Doctors. Doctors, who they do is a nurse that assists us with BHS health consult online. All the other participants in this presentation are all nurses, and we have medical doctors as well. We thank you so much for this wonderful presentation. And this is specifically geared towards menopause and hearing from other colleagues who also have shared their views on this very topic. If you have any questions or concerns, just get in touch with us and we'll let you know. This is the BHS TV Online Health Consult. You find us on YouTube. We are updating several topics on different issues. Thank you very much and have a wonderful day. Bye-bye.